Good evening, everyone. Today is Thursday, March 30th, one more day before the end of the month. It went by so fast, and we'll be starting in April. Also, remember that next Wednesday is the last day in this module. Next Wednesday is the last day in this module, and you will be having your final exam on chapters 5, 6, and 7. So make sure that you're reviewing. Also, I sent in an email earlier this week in reference to when I went in to check labs and the playground, simulation playground. Quite a few of you have not started your labs. And then if you started, you didn't complete them. And like I stated, I saw quite a few 30s and 40s and 50s and 60s. So remember, your grades are determined by your labs that you submit in the regular assignments and your labs from the simulation playground. So please make sure that you all try to catch up on those labs. That is the majority of your grade. Make sure that you're reading the emails. I have people that are just calling me almost at the end of the course about getting the codes. We're at the end of the course. Next Wednesday is the last day in this module. We'll be going to the actual sim chart. No more playground, no more playing around. It's the actual charting. And in order to work in 157, you have to have everything complete in 156, because everything that you learned in 156 with doing those simulation playgrounds is going to be in 157, except you're not going to have the steps, and you're going to be graded strictly on those actual charts. The names are going to be there, so you're going to have to be able to reference back to that chart to get the information. So if you do not complete 156 with those simulation playgrounds, you're going to fail module 157. Everything in 157 relates back to 156, except you're not going to have all of that information. So please try your best from now until next week to complete those assignments. If you need me to reopen some of your labs, let me know. But as far as your playground, all of those labs are open up until number 70. So from 1 to 70 is open, and you have 1 to 100 to complete. So please go into the simulation playground and complete those labs. You will not be able to pass module 157. I'm just giving you a heads up. Make sure that you all check in your news and announcements. Make sure you're looking in the gray section of e-learning to review those Zoom classes that we're doing. Everything that we're doing is recorded for you to play back and to review. So right now we're going to do a quick little preview, because everything is on your PowerPoint slides that's going to be on your exam. Remember, chapters 5, 6, and 7 is your final exam. So I'm going to share my screen. And we're going to go on here with chapter 6. I reviewed quite a bit of information in the last one on chapter 5. So we're going to start on chapter 6. In chapter 6, here are your I'm sure you all are reviewing, or should have, or be in a process of reviewing your objectives. Discuss the roles of the patient, the provider, and third-party payer in the healthcare reimbursement process. Describe the revenue cycle of the medical office. Discuss medical coding, the role of the electronic health record, which is EHR, in medical coding and claims processing errors, and the current procedural terminology CPT system. Remember, current procedural terminology stands for CPT. Discuss the Healthcare Common Procedure Coding System, HCPCS, HCPCS, Healthcare Common Procedure Coding System. Evaluate the advantages and disadvantages of the pay for performance incentive module. That's one of your daily assignments. List the information contained in a typical super bill and explain how the form is used in an outpatient facility. Also post charges, payments, and adjustments to a patient ledger, and discuss HIPAA 5010 claims processing. This is one of your daily assignments for next week. Discuss the concept of medical necessity and indicate how it affects third-party reimbursement. Define fraud and abuse, explain the differences between the two, and give examples of each. Generate patient statements. Explain the reporting features found within an EHR. So here, if you all are reading and when you're looking at your questions, I cannot express enough. Everything you would need to know when it comes to those questions and things on your exams, it's in your chapters and in your PowerPoint slides. Right here, it shows you healthcare reimbursement. Healthcare reimbursement is submitting insurance claims to a third-party payer. The HIPAA 5010 claim form, remember, this is one of your questions in your assignments. Patient payments, out-of-pocket expenses, co-payment, co-insurance, deductibles. EHRs have integrated practice management systems to provide billing functions. The revenue cycle, all administrative and clinical functions that contribute to the capture, management, and collection of patient service revenue. Correct identification of the patient and patient's payer can be difference between paid or denied claim. Coding systems. So for those of you who are with me when we were coding, this is going to, when you go into that next system of the billing cycle, it has medical coding. Process of assigning standard numeric or alphanumeric codes to diagnosis, procedures, and treatments for reimbursements and analytical purposes. Diagnosis codes. These are your diagnosis codes. International classification of diseases. 10th revision with clinical modification. So remember, your diagnosis codes are ICD-10, International Classification of Diseases. Your procedure codes is CPT, Current Procedural Terminology. Your healthcare procedure coding system is HCPCS, HCPCS. This will be on your exam, so make sure you all highlight this particular PowerPoint slide. What are the coding systems? Diagnosis codes, so your any diagnosis codes is your ICD-10. Any procedure codes, current procedure terminology, is your CPT. Healthcare procedure coding system is HCPCS, HCPCS. So make sure you all highlight this. This is on your exam. Role of EHR in medical coding. So the role of this is it stores complete sets of codes, links codes to appropriate findings and patient progress notes. So in a lot of your offices, when you go in, you're not going to really all the time have to have that book in front of you. I explained this before. A lot of times the clinics and the special practices, they already have the codes that they use. So if you go in to see the eye doctor, in the system that they're going to use, they're going to have that code because that's all they're billing for. So you won't have to use a book or a CPT or anything like that because the codes are already based in the system. So a lot of times with special clinics, specialty clinics, you won't have to worry about trying to find a code. Everything is involved in that code, in that system. So you wouldn't have to code for high blood pressure, diabetes, or leukemia and different cancers like that from an eye clinic. They're only going to have codes specific to that practice. Post payments in the EHR submits insurance claims, quick follow-up on unpaid patients' accounts. This is the role of the electronic health record in medical coding. Coding and claims processing errors. Coding variances, mistakes caused by computer error or by human error of various sorts, ranging from simple carelessness to incorrect application of coding guidelines and procedures. This is going to be a big part of in 157. It's going to, if you're putting something wrong, they're going to show you processing error. 157 is totally different from 156. That's why it's so important to make sure that you're going in and doing those simulations, because all of the information, like if you're getting 30, I saw quite a few people had 30s and 40s and 50s. Do it over. you know, something you're not doing correctly. But this is the playground for you to play around and get it correct. Because when you get to module 157, you're not going to be able to make those corrections like that.
So we can redo it over, right?
Excuse me?
We can redo it over.
In the playground, the simulation, yes, you can.
Okay, because when I went to look at mine, it no longer shows the 1 through 20. It shows the rest of them.
1 through 20 should still be available. It's not available for any of you all. Is it there?
I know on mine it wasn't.
Amber is gone for you. So they're gone.
Yes, ma'am.
So that means it must have timed out because I had those up there for 2 weeks.
Oh, okay.
So I can go back and reopen them.
Okay.
But the thing is 2 weeks, like I'm saying, even though you still have the time, but if it timed out, just let me know and I'll go back and reopen them.
Okay.
Yeah, so I'll do that tonight. Coding requires complete and accurate documentation. CPT coding, uniform language for describing procedures and treatments performed by healthcare providers. Category 1. We had this in the billing and coding. I know my new students, you're not familiar with this, but for students who have been here, this is what you should know. Category 1, where it starts at in your CPT manual. What is the first chapter? Evaluation and management. So it says category 1 in CPT coding, evaluation and management, anesthesia, surgery, radiology, pathology and laboratory, medicine. If you look in your billing and coding manual, this is how it will go. Your categories 1s, remember, evaluation and management, anesthesia, surgery, radiology, pathology and laboratory, medicine. This will be on your exam. Please highlight this on your PowerPoint slide. CPT coding, here we go, category 2.
Will it ask you to name the categories of the CPT?
Depending on how, when we get together, the instructors will see on how we want to do it, it might determine, it might tell you, ask you to name it, or it might be, I'm trying to think, what is it? Multiple choice.
Okay.
Category 2, supplemental codes used to help researchers collect data, track illness and disease, and measure quality of care. Category 3, temporary codes applied to emerging technology. So you have 3 categories. Let's go back 3 categories. Category 1, evaluation and management, anesthesia, surgery, radiology, pathology and laboratory, medicine. Category 2, supplemental codes used to help researchers collect data, track illness and disease, and measure quality of care. Category 3, temporary codes applied to emerging technology. Then it goes into ICD-10 coding. Anybody remember what ICD-10 stands for? What does ICD-10?
It's on the tip of my tongue. It's
International Classification of Diseases.
Correct. That's on your exam. What does ICD stand for? What does CPT stand for?
Current procedure technology, I think. Current procedure terminology.
Correct. And what does HCPCS stands for?
Healthcare Procedure Coding System.
Correct. So make sure you know what those things stand for, what those acronyms, ICD, CPT, HCPCS, that's on your certification exam. So you should definitely have that memorized. That's like some of the first few questions that they ask, because they're like, if you're trying to become a medical billing coder and you want that, you need to know what it stands for. So make sure that you know what those 3, ICD-10, CPT, HCPCS, make sure you know what those stand for. And it tells you on here, let me go back. So it translates complex medical diagnosis and procedures into a universal language used by healthcare providers to request reimbursement for inpatient hospital services, hospital-based outpatient services, and doctor office visits, overseen by the CMS and the National Center for Health Statistics. This is a trick one, so you know this is probably going to be a true or false. Consists of 68,000 codes. So what y'all think I might have on that for a true false? Think about it. I might have what consists of 50,000 codes.
Yeah.
You know, so it consists of 68,000 codes.
That's a lot of codes.
Yes. And that's for the ICD-10, and it's growing. The list is growing. Codes are 3 to 7 alphanumeric characters. Doesn't that sound like a true false?
I remember that because I remember every single time we would look in the CPT, it always started with like,
Now remember, this is ICD.
yeah.
Yep, ICD-10. So codes are 3 to 7 alphanumeric characters.
It also, it always started with an alphabet and then it ended with like the numbers.
Mm-hmm. And
Something like that.
ICD has, remember, a lot of people got this because they changed. ICD has 21 chapters without supplementary classifications. It used to be 20, now it's 21. And it's supposed to be going to 22. Coding conventions includes parentheses, non-essential modifiers, see also, placeholder X, use of a 7th character, C category for cross-reference, excludes notes. Code also notes and default codes syndromes. This is what's included in ICD-10. Alphabetic index of diseases contains diagnostic terms in alphabetic order, contains alphabetic index of diseases and injury, table of neoplasms. What are neoplasms?
Cancer.
Right, cancer. Neoplasm, so it in ICD-10, it can table of neoplasms and table of drugs and chemicals. Tabular list of diseases organized by chapters in alphanumeric order. Official guidelines for coding and reporting, and there are 4 sections. Pay for performance. This is one of your questions for this week and next week. Pay for is P4P, P4P, pay for performance. An outcomes-based payment module rewards providers for delivering evidence-based care according to specific standards, electronically documenting compliance with those standards. Incentive and penalties. This is what you're going to definitely need to know when you go into the next module. In 2009, providers used a computerized provider order entry, CPOE system, to submit claims for Part D Medicare recipients were rewarded with performance pay amounting to 2% of their annual Medicare billing. Has been phased out. This has been phased out. Providers who choose not to use CPOE are now dinged with a penalty equal to 2% of their annual Medicare billing. You're going to have that in your labs, in your playground. EHR offers, which is electronic health record, offers a way to record improvement by noting laboratory results, findings of imaging studies, and clinical progress notes. P4P module works best when applied to patients with chronic illnesses such as diabetes, hypertension, and arthritis. This is on your exam. When does P4P works best? Here it is. When applied to patients with chronic illnesses such as diabetes, hypertension, and arthritis. Super bill, you're going to have a lot of this in the next module. Also known as an encounter form, walkout form, route slip, fee slip, or checkout form. It is attached to the patient's chart for use during an office visit. Patient's copy of the encounter form serves as a bill. Remember what a super bill is for. The form includes the following information. I know you all are going to get to this. I don't know if you all have already covered this in your simulation playground, but this will definitely be a lot of what you'll be doing in module 157. The form includes the following information: demographic data, patient's name, address, phone number, and date of birth, date of appointment, guarantor, the person responsible for the account, insurance policy number and group ID, diagnosis codes, service codes and ranking, account balance. The patient ledger, search by patient name. Ledger is organized by responsible payer. Documentation of all charges, payments, adjustments, and balances to an account. Access is not limited by patient encounter. HIPAA 5010 claim processing. This is one of your assignments. HIPAA 5010 claim processing. This is very important. Once the super bill is submitted, it's time to request reimbursement for services from the third-party payers. The electronic format of the claim form is HIPAA 5010. So this is important to know. Once the super bill is submitted, where's the super bill? The form includes this information. So once all of this information is included, you're going to go here. Once the super bill is submitted, it's time to request reimbursement for services from the third-party payers. The electronic format of the claim form is the HIPAA 5010. Once the claim is submitted, it is paid, pending, or denied. So that's why it's important to make sure you have all the proper documentation, because then once it's submitted, you will get an answer back if it was pending or denied. Medical necessity, a legal doctrine that holds that medical services rendered must be reasonable and necessary according to generally accepted clinical standards. Pre-authorization, you're going to have this in the next module. Pre-authorization, a lot of times with certain treatments or certain testing you might need with your insurance, they'll say you have to have a pre-authorization before the doctor can go ahead and do it. This is what it is, pre-authorizations. Electronic health records reporting capabilities can be used to identify codes that are being consistently rejected. Fraud, misrepresentation of the medical services provided to deceive or mislead another person or entity, such as Medicare. Abuse, unintentional deception in which a provider inappropriately billed for services that are not medically necessary. Patient statements, you're going to have this a lot in 157. Generating a patient statement is how the healthcare facility let the patients know what is owed and why. It looks very much like the information looks like on the patient ledger, keeps money flowing on a steady basis. Reporting features of an EHR. EHR must be able to generate reports that can be used in multiple ways within the healthcare facility. Various agent reports will be used to determine what action should be taken. Report listing patient accounts and balances. Provider productivity can also be looked at by the office manager. Reporting function can be used for quality assurance measures. This is important. Look at the bottom. It says category categories usually seen on agent reports are 0 to 30 days, 31 to 60 days, 61 to 90 days, 91 to 120 days, and older than 120 days. So make sure you're familiar, make sure you're reading the information that's on the bottom of the slide. Let me just go back. For patient statements, it's telling you on here, refer to EHR exercise 6.9, generate a patient statement. So it's giving you the information on what you would need to do when you're generating. So always look at the information that's on the bottom of each slide. It gives you extra information on the bottom of the slide. So on here, that's any questions for chapter 6? Any questions in reference to your playground simulations? Remember, your final exam is Wednesday, chapters 5, 6, and 7. We're going to move to chapter 7. I'm just switching. You can let me know if you have any questions. Just let me know. Remember, everything you would need is right here in the simulation, right here in a gray area. Your gray area says the PowerPoint slides. I'm going to chapter 7. So this is for your patient portals, the personal health record and patient portals. So your objectives, this is all of this is in module 157. Describe and explain the purpose of keeping a personal health record. Describe the 3 ways of storing personal health record data and outline the advantages and drawbacks of each. Describe how a PHR can be synchronized with medical devices such as blood pressure cuffs, blood glucose meters for patients with diabetes, and peak flow meters for patients with asthma. This information will be gathered by that nurse or medical assistant, but you would have to document when it comes time to coding these tests that have been performed. You all should know by now what is a personal health record. So I'm not going to go through, I'm just going to go to the last thing. A means of keeping health information current, safe, and in a single location. Improves continuity of care. Helps the patient save time and money by keeping various specialists from ordering duplicate tests and procedures. The personal health record versus the medical record. Both are means of keeping health information up to date. Both offer some protection against loss of or damage to records that are stored elsewhere. Both aggregate data from doctors, hospitals, and allied health professionals into a single record. You all have covered this already in the previous chapters. What information is stored in a personal health record? This will be on your final as well. This was already on one of your exams, but this will be on your final as well. So if you want to highlight that PowerPoint, it's good. Types of personal health records: paper-based, personal health record, online personal health record. So remember, this is on your exam. Types of personal health records: paper-based, personal health record software, online personal health record. Innovative features of personal health records: synchronization with medical devices, ICE notification, drug alerts, limited inoperability, direct-to-consumer laboratory services, telephone consults, satellite, and MP3 technology. Everything now can go through satellite and MP3, like I said, the MP4, everything is basically computer-based now. And it's hard. I like that things are computer-based now, but I think it's difficult for our elderly people and for older people who are not computer savvy, because a lot of stuff, when they're trying to get that information, they don't have the hands-on and knowing how to operate and generate things in a computer. So it's pretty hard when, our older people now, and not so many old, like everybody's not computer savvy, and they don't know how to go online and get all of this information. So it have its good points and its bad points when it comes to everything being computerized. Now, even when you're looking for a job, you know, most people, they don't even take paper applications. You have to go online and complete the application. So, you know, that's a barrier for older people who don't have that computer knowledge trying to do it. And now everything is go online, go online, go online, which is a disadvantage for some. Synchronization with medical devices. Some PHR systems are capable of linking directly to medical devices such as scales, blood pressure cuffs, blood glucose meters. Then using a USB connection, measurements taken by device can be downloaded directly into tracking template or PHR. Remember, PHR, personal health record. Limited interoperability. Complete interoperability of electronic systems have proven to be elusive. And it's just like parts of certain systems are inoperable with certain external systems. Some things don't work with certain systems. So that's a barrier as well. Direct to consumer laboratory services. Takes out the middleman. Patients have the ability to use a PHR that links to a network physician who can submit the laboratory orders and refer to an approved facility, can have tests performed and have results sent to PHR account. That's a good thing, but that's still, if you're computer savvy, you know how to do all of that. It says, in the past, a patient nearly always had to visit a physician to have a blood test ordered. Now they can do this electronically. Telephone consults and MP3 technology. Convenient to be able to talk to physician by telephone. Should consider hidden charges. A lot of people, they've been complaining about that. They were having these, you know, calling a doctor, he's talking to them, not realizing they were being charged for that service. So it's always saying should consider hidden charges that you're not aware of. Technology like Fitbit allows users to monitor daily activities. Benefits to individuals, patient, and caregivers. PHRs offer the opportunity to do the following: take an active role in a loved one's health care, plan and coordinate care, learn about diseases and conditions, build friendships with and derive support from others who have the same condition, avoid duplicate tests and procedures. Benefits to providers. PHRs improves patients' compliance with instructions and medication regimens, improve patients' recall of health-related events, give clinicians an alternative means of communicating with patients if secure email can be exchanged through the PHR. So a lot of information now, you know, you can talk back and forth via technology. So, and then it helps with some who are not able to do the actual visit to a clinic. They can do the telehealth visits. Steps in creating the personal health record. You had this in previous chapters. Maintaining the personal health record. This was in previous chapters. As you say, each time the patient is seen by a healthcare provider, the patient may need to sign a specific authorization for the medical office to release his or her records. Patient portals, sometimes referred to as a tethered PHR, provider control gateways to an EHR and other services at the healthcare facility. Within the patient portal, the patient-controlled health record is a part of that site that contains data loaded by the patient. He or she alone can grant, deny access. Common patient portal menu options: appointments, send a message to your care team, personal health information, test results, medications, billings. So just like with LCMC Health, they have the patient portal, two-row, like all of that's related to LCMC Health. Auctioner system, they have the patient portal where you can put in your own information. They'll, like before an appointment, they'll say your weight, your height, blood pressure results. You can put all of that into the patient portal prior to your actual visit, so you don't have to complete all of that information once you arrive. So a lot of that information now you can do, and they really want you to do it before you arrive. But then it goes back to our older patients and elderly patients who don't have that technology awareness and able to do all of that. And then they get to the doctor and they have to wait long periods of time because they might even need somebody to help them complete that information. So I just feel that it has advantages and disadvantages. And this is one of your questions as well. So any questions in reference to your labs, assignments, anything that you will need, you know, and you want my attention right now to answer the question, this is your time. This is our question and answer session. Remember my office hours, 8 a.m. to 5 p.m., Monday through Thursday, and 4 o'clock on Fridays. So if you need to schedule something after my office hours, please give me a call, like email or text me so we can schedule after 5 o'clock, after 6 o'clock. I don't do any scheduling after 8 p.m. because at this time, after 8, I'm trying to check grades, check all of these labs that you all are not doing in the simulation playground. I mean, oh my goodness, I went in, I was shocked. I sent out that email. I'm like, oh my goodness, so many of you have not completed those labs in the simulation playground. That's majority of your grade. So we definitely need to get on it. Wednesday is the last day of the module. Yes, Trey Andre?
The man from Evolve had called me.
He
And
called me as well.
Oh, because he said he couldn't give me the code.
It's in your book. Like that code is in your book. And that's what I'm saying. I don't know, because he called me. I don't understand, but it's in your book, your electronic health record book, where it says access code. You're gonna copy and paste it and put it in the code.
Okay.
And I'll try to help you once we get off. Later on, I'll try to call and see if we can do it together.
I try to see if I can see. It's hard for me to see now.
Okay, but you know, like I said, it's been 2 weeks.
That's my fault. I'm not blaming nobody but myself.
Same.
Yes, you know, so we have to get on it Wednesday next week. Next week, I think is what, the 5th or the 6th? I think it's the 5th. Because the new module, the new module 157 starts on April 6th. So make sure you all will receive your 10 points for attending. Remember, keep track of your points so that I can add them to your lowest grade that you might have. If you might not do that well on an exam, let me know, you know, and then I can add those points, those extra points. So you all, we have any other questions, concerns, comments?
I have the access code if somebody needs it.
Well, it's different in everybody's book.
It is?
Yeah. Who am I talking to?
Amber.
Amber, you sound different.
I'm stopped up.
Oh, look, I had no idea that was you. That's what I'm like, who am I talking to? Well, I hope you feel better, Amber. So let's do this, if you all don't mind. Can you see Triandre?
Yes, ma'am.
Amber, if you don't mind, I mean, I know you stopped up. Can you share, can you share your screen and show her where the code is so she can see it, so we won't have, she can go ahead and get started?
Okay. Let me see if I can pull it up. I don't remember where I found it from.
Let me log out of this. Wait, let me move over here. Let me log this off and let me share my screen. Unshare. Okay, I'm stopped sharing and I'm gonna give you access. So let me go to multiple shares.
So does that mean that we need to start getting our big books out now? Because we're about to start on those?
I didn't hear you. I'm sorry, Misty.
I said, does that mean we have to start getting our big books out because we're about to start on those, or no?
No, the next one, we're still gonna be in sim chart, but you're gonna be in the actual chart. Yes. So
Just
Amber,
tell me
you able to
already.
share now?
Yeah. Yes, ma'am.
Okay.
Can you see?
Can you see Triandre?
Yes, ma'am.
So it's that red book, the sim chart book.
Uh-huh.
You. click on there's this little icon. With me, I already have it launched. But if you look next to the SIM chart, it says continue reading, and then right next to it says access code on it.
Okay.
And you can click on the access code and it will copy it. Or you can go to this little arrow right here, and then you can go to courseware, and it says access code right here too. If you're
Okay.
still having trouble, you can always message me and I can help you through it.
I'm finna go try it. And if I have trouble, I'll be contacting the whole class if I have to.
Andre, look,
Hey, why are we saying
No, I see where she at. So I'm gonna go and try it.
Andre, I'm gonna throw shade right now. Only after 2 weeks, you're trying to get into the code book, but I'm not gonna say anything, Andre.
That's my fault, Miss Berry. I'm not blaming nobody. I can't blame nobody. That's my fault. My head is small, but it's so big right now.
Look, Andre, though, man, I talk to Andre all the time, so she knew I'm gonna throw shade at her.
And I'm fine. I'm fine with it because that's my fault. I was to the end where I just told my grandma, I said, I might as well just quit. I'm done.
No, and what I told you, don't even speak those words. You know I'm gonna get on you. Don't speak those words.
I think she cussed me in every language but Spanish.
So, any other
I'm
questions?
going to tell you like this, Andre. If I can go through it and graduate in 2017 and come back and redo it and learn it a lot better, then I think I'm doing good.
Yes, you're doing great, Misty.
After you get the hang of it, it's really not that hard because I just got a job doing telescribe through a company and I'm doing training, and it's really not that hard once you get the hang of it.
Right. Thanks, Amber.
I graduate in May, and it's really not that hard. If you have problems, you can always message me.
Thank you, Amber. Yes, but I'm telling you, Amber is doing a great job. Look, straight A's, Amber.
Well, I know she used to get them codes like that. She used to be on them codes.
Yes, great job. Like I said, Amber is going to do well. Yes. So just keep up. Heather, I see you turning on and off, turning on and off. I can't, you on mute. You on mute. I mean, Heather, you on mute.
Get it off. I'm sorry, because my kids, and I had to go pick up my mom today from work, so I just
look.
My kids in the bed.
Heather, no, don't think Andre, you're the only one. I look, throw shit on Heather. No,
that's why I was hiding. That's why I was hiding, because I know.
I stay on Heather as well,
yes.
So that's what I'm saying. I don't want anybody to feel that I'm picking on them.
No.
You know, this is how
I feel like if I call or anything like that, that like I'm interrupted.
No, like I said, just let me know. That's why I say we could do one-on-one. Like, look, Misty, I know you're not talking. We was on the phone at 9:30 at night.
Yes, ma'am.
Look, this is Throw Shade Thursday. Look,
don't throw too much shade. My head already hurt.
Right, please don't.
Throw Shade Thursday. Yes. So
one night we were on the phone until 9:30 at night, but it was also, I think it was the night that I couldn't get into my SIM card.
Right. So that's what I'm saying. I don't mind, but I have to know ahead of time. Like, call and let me know. I mean, I'm willing to help you. I want you all to succeed. But don't just pick up the phone at 10 o'clock thinking I'm supposed to answer. I'm trying to grade papers, and that's why I was in shock when I saw those labs, and I'm like, nobody's doing a simulation playground. What is going on?
So is it all of them?
100, Heather. 100.
All 100?
Yes.
Are you adding some more?
Yes, ma'am. I put it up to 70.
God.
It's up to 70.
You get your grade by the quizzes, right?
Excuse me, Amber?
You get your grade by completing the quizzes, right?
Yes, ma'am.
Okay. I'm on part of
I have to average all of those grades plus your daily and your labs that's in the actual assignments. I have to average all of those together.
Okay.
I guess I'm just going to have to break down and start doing some of those because, like, I get so, like, fixated on the assignment and the lab. So with the other one, I'm just like,
Oh yeah, I understand because I saw when I went in to start grading, I'm like, what? Let me tell you, I have 5 classes. When I tell you, because I have independent study classes as well. When I tell you only about 20 people have done labs in the simulation playground, and that's not with everything being completed, who have started. So that means I have like so many more who have not even started. I went through some, I mean, have not done not one lab. That's why I had to send out that beautiful email. Make sure you do. You have until next Wednesday. So please get started. That is average. Your daily assignments, the labs, your exams, and your simulation playground. That's added to give you your overall grade. So make sure you complete that. So remember your final exam, it's on chapters 5, chapter 6, and chapter 7. So see,
That's
y'all
due
had
on
a break.
Sunday, right?
I'm sorry, I didn't hear you.
And that's due on Sunday, right?
No, that's your final exam is on Wednesday,
Okay.
Oh, okay, okay.
next week,
Yeah.
which is the last
Okay.
day of the module. Oh, I'm so glad you made me think. Remember, when it's the last day of the module, you don't get until Sunday to complete your exam.
Oh, right.
The last day of the module, your exam has to be done on that. So, you know, like I might help y'all out. I might open it on Tuesday to give y'all that extra time because Wednesday is it. Because we start on Thursday, we start module 157. So, you know, let's catch up. Enjoy your weekend, get those labs done, and I will see you all. I have to do my, well, Friday I'll have a video to just review some things, but you all enjoy, stay safe, and let's get busy with those simulation playgrounds.
Yes, ma'am.
Thank you so much. Y'all have a good day, a pleasant and happy and safe weekend. Bye-bye.
You too.
Bye. You too.